Hi, my name is Dr. Brian Thomson. I am a foot and ankle orthopedic surgeon with Elite Sports Medicine. Today I thought we'd do a question and answer and talk about some common foot and ankle problems that may arise and some tips that we can give you on how to deal with them. Common injuries we see in foot and ankle are mainly overuse conditions. So people that are trying to increase their training or get back to exercise when they haven't done so for a while. Sprains, we see quite a few fractures in all sorts of locations around the foot and ankle. Some common injuries we see in athletes with regards to foot and ankle would be stress fractures. So these will typically occur when a person has been training quite a bit. There may be some underlying foot problem that sets them up for it, either a person with a high arch foot or really flat foot. You might have pain before the injury actually happens, so there may be kind of a warning sign that it's getting ready to happen. Stress fractures can be challenging to treat. Other common injuries we see would be ankle sprains, Achilles tendonitis, Achilles tendon ruptures. An Achilles tendon rupture is usually an acute injury. There could be some pain before it happens. Normally the athlete is in a takeoff position, so they're exploding off their foot when they're on the ball of their foot. So it can also happen when you're trying to jump or landing from a jump. Commonly you'll see the person turn around and look behind them. If you watch videos of Achilles injuries, you will see that the person usually looks behind them because they think somebody has stepped on the back of their leg. That almost classically means they've had an Achilles rupture. So we'll test them in the office. We can usually tell there's a gap in the Achilles or that the foot doesn't sit in a proper position, and that's kind of a clue. And then I'll use things like a bedside ultrasound just to get a quick look, and occasionally MRI to either confirm or if I think maybe this isn't a rupture and we need to look further. Ways we treat Achilles really depends on the age, health, and activity level of the patient and our shared decision making with the patient. Somebody who's quite a bit older or sedentary or not very healthy, we can sometimes treat them without surgery successfully. Surgery may have a lower chance of re-tearing the tendon in the future, and it may give a person a little better strength too. So oftentimes we still do Achilles tendon repairs, whether it be minimally invasive or with a small open incision. Recovery after an Achilles injury can take 6 months to a year to get the patient back to sports and ultimately regain all of their strength. This can be a little quicker depending on the sport. For instance, if you're a hockey player and you wear a skate, it's more like a lace-up boot or a brace that would protect the ankle, and you might be able to return sooner than, say, a wide receiver on a football team that has to take off into a dead sprint with their position. So it's kind of position and sport dependent, but generally I'll tell somebody it can take 6 months to a year to get back to their sport or training specifically for their sport. Immediately after surgery, the person may have to be off their foot for a couple of weeks, and then we start what we call an accelerated functional rehab program. So you closely work with a physical therapist to make sure that you're strengthening your leg and your body in a way where you're not overstretching the tendon, because ultimate strength depends on not stretching your Achilles tendon after repair. One of the biggest injuries, the most common injuries that we see that's underappreciated is an ankle sprain. Everyone knows what an ankle sprain is. Typically you step in a hole or on an edge and your foot turns inward, and you may feel a pop and it may be hard to walk for a few days, and then you kind of start to shake it off. You have a lot of bruising and swelling potentially, and everybody's like, oh, you had an ankle sprain, and you'll get x-rays maybe that don't really show a major fracture or have a small fracture. But these injuries are underappreciated because it can represent a complete tear of the ligaments on the outside of your ankle, and we'll see patients who the pain just never really goes away. And you can have multitude of other injuries with an ankle sprain. You can chip cartilage in the joint. You can tear a peroneal tendon on the outside of your leg. You could fracture the base of your fifth metatarsal. So I think that just thinking, oh, this will go away is maybe not the best approach when you really feel like you have prolonged disability after an ankle sprain. So our first goal when we see patients with ankle sprains is to find out what all is really going on, and then directing a rehab program that's more likely to return them to function, get them in a proper brace. But if they have significant instability and the pain doesn't get better, there are surgical options for this as well. If a patient has problems with chronic instability after an ankle sprain, they may be more prone to rolling their ankle at oftentimes, and they may lack confidence to have the explosion necessary when they do their sport. They may also have persisting pain. Because there are so many things that can occur in the ankle joint, we start off the surgical procedure with an arthroscopy. So it's a minimally invasive way to look into the ankle joint and find these problems that are lurking in the joint and causing pain, whether it's chipped cartilage or inflammation or torn tissue, and we'll clean this up, and that can lead to pain improvement. Then we then make a small incision to repair the lateral ankle ligaments. Afterwards, we rehab them aggressively, so I will keep a patient off the foot for 5 to 10 days, and then we'll take stitches out and start weight bearing. They'll be in a walker boot, and they'll work closely with a physical therapist so they know the important exercises for strengthening, while at the same time not risking certain maneuvers that can harm the repair. But it's important for us to mobilize and get these patients back on their feet as soon as possible so that we can shorten their recovery and their time for return to sports and also return to work. These are both very important things in our patients' lives. I've been practicing foot and ankle and orthopedic surgery for 14 years now. One of the biggest improvements, aside from more minimally invasive techniques, is treatment of arthritis of the ankle. In the past, patients often had no choice but to undergo ankle fusion when they had bone-on-bone arthritis of the ankle. So what that means is they had significant stiffness, they had pain that affected their ability to walk on a daily basis. It was hard for them to go up and down stairs or even to go to the grocery and shop. So in the past, we had to do an ankle fusion. It was really our only good alternative until about 2008, and then we had an influx of new, really good ankle replacements. So now patients can get pain relief. They can be on their foot quicker than they can in walking with an ankle fusion. But the nice thing is the patient can retain the motion in their ankle. So the ankle replacement allows them to keep the motion while getting pain relief. And they can have a more natural, more normal gait. The most important thing is they get good pain relief. One of the more common problems that we treat is bunions. I think everyone knows that when they think of a bunion, what is it? So it is a big bump on the inside of the foot over the big toe, where the big toe sort of sticks out, and it makes it very hard for them to wear footwear, especially if you have a shoe that's harder leather or tighter in the toe box of the shoe. That's going to crowd the foot, and then you're going to get a lot of pain and inflammation over a bunion. Over the years, bunions can progress and the toe can get more and more angulated or crooked. So when a patient's tried changing their shoes and they really can't find any footwear that's comfortable, or if they start to develop problems with their second toes, which can happen. When you've had a bunion a long time, you can start to get pain under the ball of your foot. You can also start to develop a deformity of the second toe. There are so many procedures for bunions, and we have to see people and x-ray their feet and really determine how to personalize our selection for bunion surgery and make sure that we know where they hurt, and that when we do bunion surgery, we're going to address the things that are causing their foot pain. Because ultimately our goal is for them to be able to fit in most of the shoes that they like to wear within reason, but also it's to be pain-free and to function well. Because the reason people do bunion surgery isn't all cosmetic. I think cosmetics is a nice side effect of bunion surgery. It's going to look better. But the main goal is to get you functioning better and have good pain relief so you can wear shoes comfortably and do what you want to do on a daily basis. People often hear that foot surgery or bunion surgery is one of the most painful things that you'll ever go through. We have a lot of good anesthesia advances that have made foot and ankle surgery more comfortable for the patient. We do regional anesthesia now, and what this means is that much like you go to the dentist and get your mouth numbed when you have a cavity filled, we can numb only your leg. so that for the first almost day, maybe even longer, that your foot is not feeling pain. And that really means that you're going to have a lot less pain once that wears off as well. So we're able to have patients not have to rely on pain medicines for very long. They tend to do quite well with the advances in regional anesthesia. Also, surgical technique has improved. Our options for fixing bunions have really advanced such that the pain is less as well, and the healing seems to be better. So I'm often asked, how do you select a good shoe? There's a lot of things you have to consider. Number one, you have to consider what type of feet do you have. So all feet aren't the same. So you have really flat feet and really high arch feet, and they have different needs and they develop different problems. You also have to think about the activity. Do you stand all day and you need shock absorption and comfort? Or do you move all day? Do you run all day? Do you walk all day and you need a more structural shoe that's going to support that activity? So there's also weight. Some people feel more comfortable when they just put on a shoe that weighs nothing and is minimal material. But that same person may start to have pain if they go 10 to 15 miles a day in that type of really flexible, not supportive shoe. So if you have a day where you're just sitting around, choose a light shoe that feels good on your foot, but has some sole support or shock absorption. But if you have a really busy day planned where you're walking and standing a lot, you're going to want a shoe with more significant construction. It's going to be a little heavier, but the sole needs to match your foot nicely for your foot type. We often just, in general terms, for flat feet, we like the shoe to lean you outward. Your feet tend to pronate in. We want the shoe to counteract that. If we let your foot pronate in all day without support, you're going to get tendonitis on the inside of your leg, and then you'll be seeing me. So it's important to try to prevent that. If you have a really high arch foot, your feet lean out. You tend to get stress fractures on the outside of your feet or have ankle sprains. So we try to get your shoe to be what we call a neutral shoe, so the heel is even across. You know, it's hard to find people that understand footwear really well. I tend to see patients and direct them to certain shoe stores where I know there's professionals there that can fit their feet. So if you haven't had your foot fit in a while, think about this. Your size of your foot gets bigger as you age. Your arch starts to drop. Your forefoot widens. So you probably need a larger width shoe. You might even need a longer shoe. So every 5 years or so, if your shoes aren't comfortable, go get fit at either a running store or a place that sells comfort footwear. That may not be exactly what you're looking for, but it might be for work. I think the important thing is to understand how to get your foot sized at a good shoe store you like, and then get in a comfortable shoe. Beyond that, it really takes me looking at people's feet and thinking about the structure of their foot and what their activity is to help direct them to the perfect shoe. I started off my career as an assistant professor at Vanderbilt University and helped train future doctors to do orthopedic surgery, and specifically training them in foot and ankle. I also had a clinical practice there and took care of athletes. I really enjoyed teaching, and I still get to do that at Elite Sports Medicine. But what I really enjoyed taking care of athletes and dealing with sports injuries. At Elite Sports Medicine, I was in the same community. I already knew the quality of care that their patients were receiving and the quality of the surgeons at Elite Sports Medicine, as well as physical therapists. I thought they had a great team, and I also personally knew Dr. Willers and the great work he's done. I have a lot of respect for Dr. Willers. We constantly, even before I practiced Elite Sports Medicine, would talk to each other about difficult surgeries and our approaches to them, and I thought we complemented each other well. When I was looking to change practices, I really wanted to join a sports medicine practice and provide foot and ankle care, and Dr. Willers was the perfect partner in my mind for that. We currently still, on really challenging cases, we talk to each other, we make a plan, and if we want, we actually collaborate and help and assist each other in surgery still too. So that's one of the most rewarding things for me about my job, and the whole team aspect and the high quality of care is why I chose Elite Sports Medicine to practice. Appreciate your time and watching today. If you have any questions, we have some links at the bottom of our website that will take you to a website called Foot Education. That's put on by the American Orthopedic Foot and Ankle Society, and it literally lists every condition and talks about treatment. I often refer patients to there for information about their surgery or their condition, because some problems in the foot and ankle can be difficult to understand. They're complicated. That's why we do nothing but foot and ankle surgery, and that's why you have experts in the field. We can help you. We're happy to treat you, and if you're not quite sure what's going on or what to do, we can be a good resource to start. So give us a call, come see us, and we're happy to help.